Obsessive-compulsive disorder is a fairly common psychiatric condition. It affects about 1 person in 40 over the course of a lifetime. Despite that, it tends to be missed. It tends to be underdiagnosed. The core symptom is that people have thoughts that they wish they could get rid of that cause them distress, but they can't control. It could be a thought that my hands are contaminated. It could be a thought that something terrible is going to happen to me or to the people I love. That's the obsessions part. And then the compulsions are the behaviors that people will undertake in order to try to control those thoughts. For example, if the obsession is that I'm contaminated, that I have a disease, then the compulsion might be washing one's hands a great deal. We don't have a perfect understanding of the causes of OCD. We know it's partially genetic, and various environmental factors appear to contribute to possibly some early life infections, but this too is something that researchers have yet to pin down. There are 2 mainstays of treatment. There are particular kinds of cognitive behavioral psychotherapy, and there's also certain medications that can work for OCD. Cognitive behavioral psychotherapy can work very well, but it really requires the patient to buy into it, to work pretty hard and to be willing to tolerate some anxiety in order for the therapy to work. For the medications, it's a similar conversation. They can help 60% of people, not everyone unfortunately, but a good fraction. But every medication has some side effects. The side effects usually aren't so bad, but they're not zero. And so that's an important conversation to think about what's the goal, what's the benefit, and then what's the potential side effect. About 1/4 of people don't respond to the best treatments for OCD that we have to offer today, and that's not acceptable. That's something we're working very hard to change. Something that I really love that's pretty unique to Yale medicine is the incredible collaborative spirit. There are experts here in just about anything you could want, both in terms of clinical care, but also in terms of even the most technical tools of neuroscience research, and the ability to connect those different tools in the service of really important questions to try to move forward the frontiers of our knowledge and of our ability to help people. I'm Chris Pittenger. I'm the director of the Yale OCD Research Clinic here at Yale Medicine.